Can children with ADEM fully recover neurologically? Imagine a child suddenly experiencing confusion, weakness, or seizures after an infection. Many of these children are diagnosed with acute disseminated encephalomyelitis, or ADEM, a rare but serious brain and spinal cord inflammation. The good news is that most children with ADEM can recover completely. Studies show that between 57 and 90% of children regain their neurological functions fully, often within 4 to 6 weeks after the initial symptoms. Some children recover even faster, sometimes in just about a month or less. Recovery time varies because each child's nervous system heals at its own pace, but overall, the outlook is positive. ADEM is an autoimmune response where the immune system mistakenly attacks the brain and spinal cord, usually following an infection like a cold or flu. It causes symptoms such as confusion, irritability, sleepiness, and sometimes seizures. And like multiple sclerosis, which is a chronic condition with ongoing episodes, ADEM usually happens as a single event. The chance of it recurring is low, with studies indicating only about 0 to 17% of children experiencing another episode. While most children recover fully, some do face lasting effects. Around 20 to 30% may have residual neurological issues. These can include problems like clumsiness, difficulty with coordination, weakness on one side of the body, or visual disturbances. Some children might develop epilepsy or experience cognitive challenges, especially if they are very young. These cognitive issues can affect attention, memory, or processing speed, and behavioral or learning difficulties might also persist. Severe complications are rare but can happen, especially in more aggressive forms of the disease. In very rare cases, children might face serious brain swelling or bleeding, which can be life-threatening. Thankfully, such cases are uncommon. Because subtle cognitive or behavioral issues can linger even after the initial recovery, ongoing rehabilitation is very important. Therapy might include physical therapy to improve movement, speech therapy for communication, and psychological support to help with emotional or behavioral challenges. Educational support can also help children catch up academically if needed. Treatment for ADEM mainly involves immunosuppressive medications like corticosteroids, which help reduce inflammation quickly. Most children see improvement within days of starting treatment. Because ADEM is generally self-limiting, antibiotics or antiviral drugs are only used if an infection is suspected or confirmed. The key is early diagnosis and prompt treatment, which greatly improve the chances of full recovery. In summary, children with ADEM usually have a very good outlook. The majority recover completely, especially with early treatment and proper rehabilitation. However, a smaller group may experience ongoing neurological or cognitive issues that need support. It's important to remember that ADEM is different from multiple sclerosis, which is a long-term condition with recurring episodes. If you suspect your child has ADEM, consulting a healthcare professional is essential for accurate diagnosis and personalized care. Every child's experience is unique, and with the right medical attention, most children can return to their normal activities and enjoy a healthy future.